morning, everybody. Today we have with us Dr. Thomas Levy. We are here in Chennai at the Prism Integrative Medical Conference, the first of the kind which has been done in India. Thank you, Dr. Levy. Thank you for gracing this occasion. Thank you very much.
My pleasure. I'm happy to be here. I'm happy that you all want me here.
Yes, it's really great. I was going through your CV and it looked very interesting. Having been practicing cardiology for a long time, for 15 years, and also being a bar certified attorney, then you have moved into this field of integrative medicine.
It's been a journey, maybe a bit of an odyssey. I suppose I was a, shall we say, traditional mainstream cardiologist until roughly 30 years ago. And I enjoyed my profession and I felt I was helping people, but I had a feeling, quite honestly, that there was something else I should be doing. And at about that time in 1994, in Colorado Springs, Colorado, I met Dr. Hal Huggins.
Okay.
Dr. Huggins, in my opinion, is the first real biological dentist
Yes.
that we've had in the world, and many people have come since then from him. Biological dentistry meaning a dentist who doesn't just approach dentistry from a mechanical point of view. I mean, he realizes that the mouth is integrated with the body, that infected teeth affect the body, the whole ball of wax, mercury fillings, etc. And I got to know Dr. Huggins, and at about the same time, ironically enough, that I was having my questions about where my life should be headed, I met Dr. Huggins, and he said, "Come by my clinic, come see what we do." And I said, "Okay." And at that time, Dr. Huggins had a massive clinic, very large. He had 60 employees. He had patients coming in from around the world.
Right.
That would come in for 2 weeks at a time for what we called a dental revision,
Okay.
mercury, infected teeth, proper diet, supplementation, counseling, etc., blood work. And I came by several times and I saw progress in different patients that didn't make sense to me. I literally saw a couple multiple sclerosis patients that hadn't walked in years take their first few steps, not brisk, but take their first few steps.
Fantastic.
After a couple of weeks of Dr. Huggins' protocol. And I particularly remember going by his office one afternoon, and there was a little old lady, quite ill, in a wheelchair. He had a lot of neurological patients, and she was getting ready to have hours of extractions and other sort of dental work that puts a college kid to bed for a week. And as the work proceeded, she literally began to get more and more energetic, more and more enlivened. And by the end of the dental work, a couple hours later, she was asking her caregiver to take her out to some restaurant in Colorado Springs that she could chew on the other side of her mouth. And about that time, Dr. Huggins walked into the room. I said, "Okay, Dr. Huggins, I give up. What's going on here?" And he pointed at the IV bag.
Right.
I said, "Okay, that's interesting. I know about IVs."
Yes.
He said it's got 50 grams of vitamin C in it.
Right.
And I, for one, am not in the habit of denying what my eyes have witnessed.
Exactly.
Okay. And literally in that instant, in that moment, I knew my life had changed. I knew nothing about vitamin C more than anybody else, that, hey, it's a vitamin, you get it in oranges, the whole, and that it was good for you, but nothing in terms of therapeutics. And so literally in that instant, shortly thereafter, Dr. Huggins invited me to be a consultant to his clinic. I gave up my cardiology practice. I worked full time with Dr. Huggins. But from the point in time that I saw that first patient with the 50-gram IV vitamin C just blossom like a flower coming out in a few hours, that began literally the roughly 4 years of research I did on several thousand articles to write my book, Vitamin C, Infectious Diseases and Toxins, Curing the Incurable. And many more books since then. And it was with Dr. Huggins that I also started seeing the correlation. I mean, he made the correlation for me, but I saw the relationship that vitamin C had to ameliorating all diseases, and couldn't figure out why at the time. And interestingly enough, you saw in my CV about being an attorney. Also, in the course of being with Dr. Huggins, even though he was the kindest, gentlest person in the world that cared more for his patients than anybody I'd ever seen, it's almost like the patients saw a susceptibility there. He had more legal issues. He actually had a lawyer on retainer in Colorado Springs. And somewhere along the line, I guess I thought self-protection, I don't know what, but I had the time. He paid me well. I had the money. For some reason, I had the inclination. So I applied to the University of Denver Law School, which is about an hour commute from Colorado Springs, and over the next 3 years got my law degree. And I can't say I've done much with the law degree, but I do feel it has given me protection.
Good.
Okay, and given me some insights that I wouldn't have had otherwise. And so since then, I pretty much dedicated myself to research and writing, trying to evolve the concepts that we'll be talking about here at the conference.
Excellent. So it's wonderful to know your journey. It started almost 30 years ago. And then when you started with Dr. Huggins, you did a bit of research for 4 years, you mentioned, for the first 4 years, and which led to publishing a lot of books. I think probably you have more than a dozen books which have been published.
Right, 13.
13 books, vitamin C and magnesium and death by calcium and all those kind of books, which we'll list out at the end of this short video. So can you tell us a little bit more about the research and the things what you did at that time, which led to the publishing of these books?
You know, it's kind of interesting how things sometimes mesh without you realizing it at the time, because I really didn't even realize at the time I first saw what vitamin C could do, how it was truly going to end up being the single pivotal substance from which all uh, lack of which from all pathology generates, and the things that you could do with it. I actually modeled my book after that of Dr. Irwin Stone, who wrote a large book on vitamin C. And I consider sort of like an update on his. He wrote his, I think, in the 70s. And so this was in the 90s. And so I researched the literature for the next 25, 30 years and added all the pertinent references. But it became very readily apparent that even though today vitamin C is not even mentioned in the textbooks of medicine.
That's right.
Okay, not even mentioned. It's probably the most researched substance on the planet. I mean, PubMed has like a sum over, I think the last time I checked, 75, 80,000 articles on vitamin C. This substance, 80,000 articles, and our textbooks of medicine couldn't find some way to even mention it therapeutically. And of course, that rang a lot of bells back then too. It says I was, prior to all this, another mainstream innocent, if you will, who actually believed that mainstream medicine was good for the population, etc., which unfortunately I don't believe is so true now.
Yes.
Because so many things that I know now work and have been documented to work. Not only will mainstream doctors not use them, they'll actively suppress them.
Yes.
Okay, and that's where we go from negligence to evil. Okay, the number of emails I've gotten from around the world, from mothers, fathers, brothers, sisters, nephews, uncles. You know, my dad is dying on the intensive care unit of sepsis. I want him to use vitamin C. What can I do? And
that is a challenge we even face here, Dr.
yes.
Levy. I had one, I remember as one patient in ICU, and it was a distant relative of mine. And the ICU staff had given up hope. But then the husband wanted me to try vitamin C, which I then procured and then gave it to the intensive care doctor, spoke to them. They said they'll try, but they didn't. And they lost the patient after a day or so, So the resistance is there across. I don't think being practicing in a different country makes any difference.
No, I agree. I mean, I get these letters from around the world, so it's not just United States, not just India, it's everywhere.
And even when you give them the authorization, the protocols and things, people are not willing to sort of do that.
I mean, I know in law, when you're a specialist in a certain profession, you not only have a normal obligation, you have an elevated obligation. And so in the case of medicine, it's not enough for a physician to say, well, I'm not aware of that or I'm not familiar with it. It's his or her obligation as an elevated level of responsibility to the patient to make themselves aware of that. I mean, in law school, they made that very clear that any regular lawyer could practice any specialty of law that they wanted if they took the time to become familiar with that area of specialty. And the same should be the case with medicine, but unfortunately, they just like to split themselves into 100 subspecialties and not really take responsibility for anything. But my personal opinion now as a lawyer, as well as working in what I've done, is an ICU physician that's often gets a packet of articles on the vitamin C. The patient's family might even bring in a consultant doctor who's very familiar and has worked with it. Okay. And then for that physician to refuse to give the intravenous vitamin C, they need to be held accountable as negligent manslaughter and go to jail when that patient dies. It's that simple. I mean, you can't wear a white coat and a stethoscope and completely avoid responsibility for your actions. And their actions actively kill people, uncounted numbers around the world every day.
So it's a very sad state of affairs. But I think COVID has opened up a lot of people's minds seeing with regard to vitamin C. Is that how you see it, COVID and post-COVID? Because we have got research papers from China and across the world where they have actually documented the use of vitamin C with some very good results. So, do you see a change post-COVID?
No, that's an excellent observation, and I agree with you completely. It's my opinion that early on, the FDA in the United States, who pretty much knows about vitamin C, but they sort of failed to suppress it quick enough. And not only in China, but in a few hospitals in New York, a chain of hospitals in New York, early on in the pandemic, like the first few months of 2020,
very early on,
started protocols with IV vitamin C getting great results. And sort of the cat was out of the bag. Okay, couldn't put it back in the bag. And ironically enough, this is very ironic. China was and has been really, before the pandemic and with the pandemic, the world leader in vitamin C therapy. I had the opportunity with a colleague 5 or 6 years ago to go over to China well before the pandemic, and they use lots of vitamin C, and not just in micro doses, in gram doses for different conditions, for sepsis, for acute respiratory distress syndrome. And early on, without getting into responsibility for the pandemic, I'll leave that for another day.
That's right.
One of the main provinces in China sent to, I forgot the name of the area of China that was affected the most. Wuhan, correct. Tons of vitamin C powder. Now, would any state in the United States have any reason to send to another state in the United States tons of vitamin C powder? No, they wouldn't know what to do with it.
Exactly.
So very early on, that was an indication of the incredible role not only that vitamin C was playing, but was going to play. So, and it's been proven out. I mean, for those who want to open their eyes, even Dr. Fauci, for whom I have no regard at all, disclosed early on that he takes a gram of vitamin C a day. I found that very interesting, considering the fact that not a word
Mm.
about the benefits of vitamin C, to my knowledge, had ever left his mouth.
Yeah.
So it's no, the pandemic has been an eye opener in many different ways, and I was hoping what would happen has happened, which, like you said, is it takes a long time
Hmm.
to get the public awareness
Absolutely.
elevated on any particular issue. But now I think finally, I don't know that a majority, but a substantial
Yeah.
percentage of the population is finally aware of the fact that maybe their government doesn't always work in their best interest, to put it as diplomatically as I
Yeah.
can.
I think it was a very challenging time, and now that it is behind us, we cannot assume that the future is all going to be rosy, you know. So we have the responsibility of educating the doctors as well as the public the benefits of vitamin C and also the benefits of holistic living and integrative medicine going forward, you know. And where do you see you have seen this journey in the last 30 years? I mean, I have been doing this for the last decade. Where do you see this going forward, going ahead? How do you see this thing developing over a period of next maybe 10 or 20 years?
Well, that depends on how hard
They,
the powers that be fight against it. I mean, it's you just have a balance between a growing amount of the public realizing that most of the time the answer to their problem is not a prescription. Okay.
very
Obviously, prescriptions in the drug industry is far and away where the most money is. And generally, billionaires don't budge.
Mhm.
Okay. So, uh, however, I've always thought, I see so many times someone comes and says, "What should I do?" And I say, "Well, you have a series of IV vitamin C's, it's other stuff." And they come back and say, "Well, uh, a dozen IVs over the next 3 months is going
Mm,
to cost me $5,000,
mm,
and my insurance doesn't cover it."
mm,
And now I'd be talking about cancer.
mm.
So, I'll go ahead and I'll get the chemotherapy. And the ironic part is the chemotherapy will cost the insurance company $100,000.
Exactly.
Okay,
Much more expensive.
and that's a funny thing to reconcile too, which because people don't like to spend money. So where is the truth there as to what's going on? If it could ever happen, and I don't know that it can, uh, legislation that simply does one thing, and that is give the patient the right to use his health care uh, plan for whatever he wants.
Exactly.
All right. Then everything would come crumbling down. Okay. You wouldn't have to say suppress vitamin C, promote vitamin C, hydrogen peroxide. You wouldn't have to do any of that. Just let the patient go where he wants to go, where she wants to go, and have the right for her health care plan to pay for it. And then eventually we get where we need to go. Uh,
That
I'm not by nature as optimistic a person as I guess I should be. I mean, optimism is good, but I tend to come across realism more in wow, the powers that be are truly entrenched on this. But I hope and I pray that we can continue to proceed in this direction. And the pandemic has done a great deal.
Mhm,
I mean, we saw people saw doctors refusing to give,
mhm.
you know, ivermectin,
Mhm.
hydroxychloroquine,
Yeah.
etc. And I knew it was going to be a fight early on because something happened in Nevada, like the first in 2020, that truly opened my eyes. Governor of Nevada,
Mhm.
the governor of Nevada, a politician, not a doctor, nothing, executive order declared that hydroxychloroquine could not be given in the state of Nevada. I said, wow.
So that's the powers to be we are actually fighting against. And here we had the two points I would like to add to what you're saying. The insurance is actually going the right direction here in India.
Okay.
We have got the Insurance Regulatory Development Authority (IRDA), which is giving an additional cover of a holistic medicine. Whether the choice is actually given to the patient to opt for that, I'm not sure of, but they're actually trying to cover some of the additional treatments what we are speaking about.
You know, ironically enough, in the larger countries where there's less dollars per person involved, and India, of course, is huge.
Yes.
Suddenly, at some level, the government becomes aware of economy.
Mm.
Okay. The government knows that holistic orthomolecular medicine
Yes.
is far less costly than traditional medicine, mainstream medicine. But they're going to support that as long as they can. But when it finally starts threatening the national budget, then suddenly, which I think is the case here, you start to see a bit more of a shift. They're not so enamored of orthomolecular medicine as the fact that they do know at some level it costs a lot less.
Absolutely.
It keeps the patient out of the doctor's office.
Yes. And the thing with ivermectin as well, I mean, at least here in India.
No, early on, y'all had nice little packets of ivermectin.
The physicians who are aware of it, we are very happy and using it, and even using it even till today. But again, certain countries like Malaysia and other people, like you said, there was an executive order just completely, stopping those medicines. Officially, you couldn't prescribe any of those medications.
That's hard to believe it would ever happen, but it did.
It did. Right. So, shall we go into a little bit more into the orthomolecular medical side of things, with regard to vitamin C, and what are the major applications of vitamin C which you are using for it as of today?
Well, first, with orthomolecular medicine, people should realize ortho means correct and molecular means molecule. So basically, orthomolecular means use the right molecule. And basically, the concept is all diseases, 100%, are a deficiency of one or more natural substances. And when you can identify and restore those deficiencies, you bring somebody back to health. And in that regard, vitamin C is the prototypical orthomolecular agent. It literally, without exaggeration, is the fuel upon which all cells run. Okay. That, in a nutshell, is the overview of what vitamin C does. It makes sure that all electrons, actually, technically speaking, electrons are the fuel. Electrons are the fuel, and vitamin C is the distributor. Okay. You get new electrons from your diet. Vitamin C and other quality antioxidants distribute them. Okay. And without that distribution, cells remain in the electron depleted, oxidized state.
Yes.
And when biomolecules are in an oxidized state, they no longer function. They become inanimate players. They don't play a role. All they do is occupy space and then keep the other reduced biomolecules from properly interacting with each other. And actually, that in a nutshell is all of disease. All of disease is oxidation. You read in the literature that oxidation causes disease. Not really. Oxidation is the disease. That's a very important point. And beyond that, the way you restore health is you get enough antioxidants and new electron sources to restore those electron deficiencies of the oxidized biomolecules, and people start to get well. Most chronic diseases don't respond that well because, as we'll talk about in the conference later on today, we live in a cesspool of toxins. Toxins are all pro-oxidant. Toxins all take electrons away that the antioxidants are trying to restore. So it's a continual battle in your body, if you will, between toxins and quality antioxidants like vitamin C. Vitamin C is not the only one. There's a bunch of them, but it's the main player because it gets distributed so well throughout the body. They talk about other powerful antioxidants so much better than vitamin C. Well, maybe in a laboratory test tube, but the measure of the quality of an antioxidant is its ability to work inside the body and get everywhere it needs to go. Most of these other super antioxidants, they talk about astaxanthin a
Yes.
lot as being super powerful, 6,000 times
Yes.
more powerful. Well,
That's the most popular one of
yeah,
it.
the thing is it's fat soluble. It just goes into fatty tissue. It likes the eye. So it's great, great support for your eye, but it's got little to nothing to do with supporting antioxidant function in most of the rest of the tissues in your body. So it's the ability of the antioxidant to get around and not just how powerful it can donate an electron at a certain
Get
stage.
around and enter into the cells.
And enter, yes, no, right. Well, you have vitamin C is small. Vitamin C looks like glucose and uses the glucose transporters. Okay. It can donate 2 electrons rather than 1, okay, per molecule. It has an intermediate state called the ascorbyl radical, where after it's donated 1 electron, it circulates in the system, and depending on the needs of the microenvironment, is available then to donate 1 more or to take 1 back. So it satisfies the microenvironment needs. So no, vitamin C is unparalleled in its clinical application and importance to the body.
Excellent. And when we start using these for various conditions, I think one of the things what we notice is the dosing is we slowly build up the dose to a higher dose. Is there a maximum dose of vitamin C when we give them intravenously? I know orally that there is a maximum dose because it's all bowel to do with bowel tolerance. But is there a maximum dose which you have used, or some difficult patients where we can use a bit more than what your normal dosing is?
You're only really limited by the amount that you have and the time in the day to give it. I mean, we've given at the Reardon Clinic as much as 250 grams a day.
A day.
Okay. And vitamin C, as a matter of fact, this might sound like an exaggeration, but I've looked for an exception and I haven't found one for years. Vitamin C is the only agent or substance for which no toxicity level has ever been found.
Right.
Okay. And take it compared to water.
Mm-hmm.
You get some psychiatric patients that drink 2 or 3 gallons of water in 15 minutes. They get cerebral edema, go into seizures, and die.
Mm.
Well, if all you did was take water and now you're dead, that's a toxic effect. Okay.
Well,
You
yes.
can't kill somebody with vitamin C. You can't make them sick with vitamin C. I say that, yes, people thought, oh, the diarrhea. No, that's an effect that vitamin C has in pulling fluid into the colon. There really is no toxic effect. The only time you see a, quote, toxic effect of vitamin C depends on the immediate impact it has on the patient. Like if you have a patient with cancer,
Mm-hmm.
A patient with an advanced infection,
Mm-hmm.
or an elderly patient who's accumulated a lot of toxins in their cells. Giving large amounts of vitamin C in those can sometimes either kill cancer cells rapidly and release substances in the blood that are toxic, or kill pathogens rapidly, do the same thing, or the vitamin C gets inside the cells of the elderly person with a lot of toxins and reduces the oxidized detoxification enzymes so that they start working more and kicking stuff out.
Right.
So, under those 3 circumstances, you'll see the patient get a little worse clinically. But it's not due to toxicity of vitamin C, it's due to the fact basically that it's killing pathogens, killing cancer cells, and knocking toxins out of the body.
Yes. So he's actually getting cleansed internally. Everything that is
Yes.
coming out in the bloodstream and then going out. That is the short dip he's having before he actually gets better. He or she actually gets better.
So, it's a pretty amazing substance.
It is. It is wonderful. I think it's been a pleasure listening to you talk. Do you have any other things which you would like to tell us? Anything which is close to your heart, and how you would like to do it in the future?
Wow, that's a good question. You know, kind of like what we talked about already, I would like to see more doctors give a damn.
Yes, absolutely.
Okay, and
And this,
And I was very reluctant most of my life to be critical of other doctors, but no more. I've seen too many patients be number 2, 3, 4, 5, 6 on the list
Mhm,
of concerns to the doctor. Okay, and I'm no saint, but I took my Hippocratic oath seriously,
mhm,
and I'd like to see more doctors realize that it's fine to make a good living
yeah,
practicing medicine,
absolutely.
but that shouldn't be your primary
Yes.
overriding goal.
I completely agree with that line of thinking, you know. So at the end of the day, we are healers, and we have been born in this world with a special purpose, and which is to heal people, you know. And
Yes,
you can make a good living out of it, but that should not be the primary motive.
exactly.
Excellent. Thank you, Dr. Levy. Thank you.
All right.
Wonderful,
Thank
wonderful
you.
for a
Thanks
great
for having
session.
me. All right.